Hi, this is Dr. Walker again, and talk a little about some things that you can do to help yourself during the upcoming flu season. Hey guys, this is Dr. Walker. Thanks for listening again. I thought I'd do a video on the flu season and things that I personally do to sort of keep myself safe and in good health during the season. I did this before. However, my video was removed from YouTube, so I'm trying to quiet this one down a little bit more, and hopefully this one will stay. And I know people always talk about or concerned about COVID and Corona and things that they can do for themselves, but just remember again, the most common cause of the typical cold is rhinovirus, and the coronavirus is sort of the secondary common cause of cold, not the COVID SARS-2 version, but the coronavirus in general. So one thing I do is I take lots of vitamin C, and I take somewhere between 2,000 and 3,000 milligrams a day. I take one in the morning, usually one at noon and one in the afternoon. Lots of conversation about taking too much vitamin C, how it'll cause you some belly problems and diarrhea and those kind of things. But if you take it sort of in this way, one in the morning, one in the midday, and one in the afternoon, typically it shouldn't cause you any issues. And again, this is important in iron absorption, for example. Forming collagen would be another thing that it does. Great booster of the immune system, and great antiviral as well. Some studies as well showing folks using high dose vitamin C and taking care of people with coronavirus, especially when they have pneumonia or in ICU. Dr. Merrick did a study out of EVMS a few years ago and showed some improvement in those folks taking. But again, that's really high dose of vitamin C. So the thought is that taking sort of a lower dose of vitamin C, again with the boosting of the immune system, may help some people. And again, I use this sort of as a mainstay for me. Some studies also show that people with sort of low vitamin C levels and low vitamin D levels actually have increased risk, if you would, for having complications with respiratory tract inflammation or infection or things like pneumonia. So again, I take this at the levels that I sort of mentioned, and you can see sort of the RDA recommended on the bottle on this one. The other thing I take is vitamin D, and you can see this one is 1,000 IUs. Ideally, if you have the opportunity, you should have your vitamin D levels checked. Typically, the number that you're looking for is 10 ng per milliliter. Again, ideally, it's for you to get it checked. But most people can have usually about 1,000 IU per day without having much complication. Now, let's talk about vitamin D toxicity. In 20 plus years of medicine, I've not seen a case of it. I don't really know what it is, but it is a fat-soluble vitamin, which means that it's stored in your body a whole lot longer than other vitamins. So yes, you can get some complication. I've heard some things about renal compromise from this, or kidney compromise from this, long term or high doses. But the number I've heard that this happened is people taking sort of bottles of vitamin D. So I'm not recommending you take bottles. Obviously, I take between 2,000 and 3,000 IUs again per day. Dark-skinned people tend to have less vitamin D levels, if you would. Again, vitamin D is sort of gained from the sunlight for the most part, and for most of us, especially in the wintertime, we're in-house for the most part as well, so we're not outside getting some of that sunlight, which is where you get most of your vitamin D levels from. But again, vitamin D, great regulator of calcium, bone and muscle health. If you would, decrease your risk of long-term complications with infection or inflammation. Again, just to name a few things that it does, but low vitamin D levels tend to be a complication. I know that there was some discussion about low vitamin D levels in folks in Italy the older folks in Italy. And again, but you can imagine if you're in-house for the most part, most of the day, then your levels of vitamin D will likely be low or can be low. But ideally, check with your doctors to be certain that your vitamin D levels are in fact low before start taking higher doses. The other one I take is zinc. Zinc is lots of studies again that talks about zinc sort of reducing your cold symptoms by about 1/2. It's again one of those things that's not sort of made in the body by itself. You must consume it, must eat that food with with zinc in it. Typically shellfish, nuts, some vegetables as well. Help with healing, help with iron absorption. Great antioxidant, great for things like wound healing. So again, overall reducing your inflammation of your system. Zinc I take about 50 milligrams per day. Now I'll add one more caveat to this. I work with a lot of folks who are in direct contact with people with COVID-19. So the pulmonologist, for example, the respiratory therapist would be another set of people. And these are sort of the common things that many of them take. And the other one I'm going to talk about, some people take it, some people do not take this selenium, which I'll talk about in a second. But the top three I just mentioned a second ago, the vitamin C, the vitamin D, and the zinc, a lot of these folks who are sort of in direct line with COVID, they take these, and again, not to prevent, but sort of to help to boost their immune system so that when they do have a problem or complication from a virus, then this may help them. And again, last but not least, the selenium. You can see the dosage here on the bottle as well. 200 micrograms is what I do per day as well. Again, great for things like wound healing, boost the immune system as well. And it reduces sort of stresses on oxidative stress on the system, oxidative stress in the body, which essentially causes lots of free radicals. Free radicals you get from things like sort of if you're a smoker, for example, or if you drink a lot of alcohol, then you get sort of this oxidative stress, which causes a lot of free radicals. Selenium helps to sort of recover those free radicals again, helping with your cells sort of healing themselves or fixing themselves if they have damage. And again, this is just my sort of list of things that I take. And this is after sort of talking with lots of people in facilities where people are sort of in direct light or direct sight of taking care of people with COVID. But I use this. I've used many of these, the top three that I mentioned before, for years. What I've had added recently is the selenium. And again, it's just to help boost my immune system going forward in the fall. So if there are other things that you do that helps you to protect yourself from or just to boost your immune system as well, let me know, and I can add some of those to the list so other people can see them, what other folks are doing to help themselves. Otherwise, you stay healthy and stay well, Dr. Walker. What I have done in the interim, or in the interim, right, is I've been walking essentially 10,000 steps per day. Today, for example, I have currently 18,000 steps, 9.16 miles, and it's 1:40 in the afternoon.